Welcome to Town Talk, and we are so pleased to have Lisa Cullity, who is the health agent for the town of Pembroke, here on set with us today. Welcome, Lisa.
Thank you so much for having me.
Lots to talk about. First, can we talk
Sure.
about what does a health agent do within the Department of Health?
Absolutely, and that's going to depend a little bit on your infrastructure of a town and or the size of the town, but most of the communities around here, approximately the size and shape of Pembroke, your health agent is pretty much going to do it all. They're going to do all sanitation enforcement, whether that be restaurants or housing. They're going to do Title V if a municipality does not have a subsurface disposal facility of its own. We're also going to do a certain amount of health containment, either from livestock to human. We're also going to track communicable diseases. But basically, if it has to do with keeping you alive, and it's not a threat from fire, and it's not a threat from someone assaulting you, chances are it touches on the Board of Health.
Okay. How long have you been the health agent?
10 years now.
Wow.
I know. Trust
Wow.
me. I thought
Okay.
about that the other day, and I'm like, wow.
Okay. Now, this is the time of year. This is cold and flu season.
Sure. Cold and flu season is in full effect.
Obviously, there's a little more emphasis on it this year
Yes.
because of the coronavirus.
Sure.
So let's talk mostly about, as a health agent, what is your advice to people on cold and flu season?
And it's funny that you mentioned the coronavirus because we as a society like to get excited about the new virus that's coming out. The funny thing is, for the most part, there are some anomalies. They behave the same. Whether we want to talk corona, H1N1, norovirus, we could throw 100 names in front of this, but the same principles apply. Most of these diseases are particulate-borne. They're from some of the fluids in your body if you were ill, leaving your body and somehow being ingested into someone else's body, which usually has to involve your eyes, nose, throat, mouth, area to enter you. So the things that can vary a little bit and make it a little more scary is how severe of a disease it is, and or how long does that disease survive outside the body. In other words, can it go onto a surface and then be transferred into you? So those are the variables that are going to change on how big and bad and scary they are.
Right.
So when we go talk about these things, I think it's important to come back and remember that these are diseases. They are all around us every day without fail. They will cycle through different diseases. And again, I don't want to make light and say we have nothing to worry about, because we should be thinking about this, but at the same time, unless you're in the center of a severe outbreak, there's nothing to panic about.
Right. But it does make us kind of do a reset to what is the most important thing, and that is?
Sure. The most important thing is sanitation
Hygiene.
and cleanliness. And it's interesting, there was a lot of media news out there talking about the fact that sanitizers were selling out all over the place, and the N95 masks were selling out all over the place. And don't get me wrong, these things are wonderful tools to avoid ingesting or having particulates of other human liquids enter your body. I'm not saying those things aren't wonderful things, but at the end of the day, the average person doesn't need an N95 mask. The average person needs to wash your hands, wash your hands with warm water and soap, not just splash them under the sink and go. You definitely want to approach your sink. You want to get that water nice and warm. You want to get some sort of a soap. And an interesting trick I learned the other day, a good way to time yourself if you're not sure you're washing your hands a lot, sing happy birthday. That is almost the exact appropriate amount of time.
And I don't think anybody really spends that much time.
I no one spends that much time, but you really should spend that much time. But it's a great little trick to get your mind off of standing there and saying, oh, I got to go do whatever, and take a moment to truly wash your hands. You don't have to sing happy birthday out loud. You could, but you don't have to sing it out loud, but it's just a great little trick to get yourself to slow down.
So I know here at PAC TV, we have 18 plus people that work here, and we work in very small environments, and we share everything. So we've just been cautious about answer your own phone, or if you're sharing a phone with somebody, just wipe it down. Keyboards, mouses, things that everybody puts their fingers on
all the time.
All the time. Those are things that can just spread germs in general, let alone viruses.
You're absolutely correct. And that's why hand washing is so important. A lot of people love to use the hand sanitizers. And again, I'm not taking anything away from hand sanitizer. When you cannot wash your hands,
they're great.
Hand sanitizer is awesome. It's a great tool to use when you have no other tool. But it's not the tool you want to go to first. Wash, wash, wash. And that's why periodically washing your hands, never mind just after you go to the bathroom, but just periodically stopping to wash your hands throughout the day is always a good thing. But like you said, when you talk about shared equipment, because some people have no choice, that's when those sanitations and wipes help. Giving everything a quick wipe is just one more layer of insulation. And the more layers of insulation you add between you and the droplets that may have come from another human being is the more protection you've bought yourself.
I noticed too, a lot of people even in the stores now, they'll wipe down before they push the cart.
Yep.
People don't necessarily want to be on a hand railing. They might use their sleeve to go down the hand railing. If people are just more aware that germs are everywhere. And why not protect yourself from them if you can?
Of course. And that's why all those things are important, all those extra steps we can take. Again, good hand washing is great, but of course, let's face it, we live in a society where you are eventually going to come into contact with things other people have used, whether they're a bathroom door, a grocery cart, or if you take public transportation.
Oh yeah, the pole.
The pole if you take public transportation, but even if you go in and out of a large environment building, and that's where all those surfaces are there. And if you can avoid touching them, yay, you've given yourself an extra benefit, but sooner or later you're going to touch something, and that's why washing your hands and everything else. And again, if you cannot wash your hands, you're taking the tea and you're going outside to a park, that's where the hand sanitizer really becomes a nice little crutch, a nice little gimme when you don't have something better.
And the other thing a lot of people don't seem to realize is how important it is to not touch your face all the time, and your eyes and your nose, because that's the easiest place for any germ, any virus to get into your body.
And I am the worst infractor of that. I will come right out on camera and admit that I've worked on it over the years, and I'm much better at it. But I'm one of those people, if I get a hair in my face, I'm immediately swatting at it. If I get an itch on my nose, I'm immediately scratching it or my lip. So it's something I think about a lot more. And as I've gotten older, I've tried to say, okay, no, we're not going to do that. We're going to go. Or if I do need to, I mean, obviously, if you have something in your eye, you have to deal with that. But go wash your hands
first.
Then deal with the whatever's in your eye or whatever else if you can.
Now let's talk about the town of Pembroke in specific of an all hazards plan. And let's use, for example, last year, was it when we had the outbreak with the mosquitoes?
Yes.
And the town said we're going to cancel everything after dusk. That is a good example of what? What is that called?
So in every community, not just Pembroke, there's an all hazards plan. And that's a facet of emergency management. Every town has a plan. Most towns have adopted an all hazards plan because the people involved, regardless of what the hazard is, no pun intended, is the same team of people. Who's going to lead the efforts versus who's going to support on those efforts will change depending on what the hazard is. So when we talk about mosquitoes, obviously public health is one of the lead people on it. The public health department would be working along with the state in the case of aerial spraying. And our biggest function once the state decided we were going to aerial spray was to inform as best we could or share that information on our media outlets with the public. So with any one of these responses, people are always in a situation like this, if they're worried about corona, or in the situation of the mosquitoes in the Triple E and the West Nile, everyone wants to go, well, what's the plan? Why aren't we doing it right now? There's actually a very good reason for that, because no plan should be enacted before there is an actual threat. And I know for someone who is sick with a norovirus, or someone who has contracted Lyme disease or Triple E, that doesn't sound good. You're like, but I have it. We should have been doing something now. I never should have had it. But unfortunately, the reality is there are diseases all around us of all formats. And there's a statistical threshold that has to be met before an all hazards plan or any plan, whether it be federal, state, or local. There's a certain number of cases, there's a certain number of positives, there's a certain number of indices in any response that'll trigger a response. We don't go into a full hazard response for one or two patients. There are statistics for every disease and every hazard we face that equals a response for a number of reasons.
And every response you have has a ripple effect. Like, for example, if you closed a school for a day for some reason, even if it's for mold or whatever reason you close a school for a day, it affects jobs. It affects people that now suddenly don't have any child care. So when you say you have to base it on statistics, you really have to, because of the outliers that happen because of that.
None of these actions are without consequence. So now I'll go back to the mosquito and the aerial spraying. This was a real problem for a lot of beekeepers. And there's people whose livelihood depends on beekeeping, and for them it was very problematic because the state tried to come up with a spray plan, but depending on the wind and where the planes were taken off from and fueling from, the state couldn't guarantee exactly which areas were going to get sprayed. And also, again, even the slightest puff of wind did move those clouds of treatment. So it was very difficult for the state to say, well, we're treating this place, this time, this night. It was impossible for them to do so. So on the second round of spraying, they didn't do it. So local beekeepers were quite upset,
Sure.
saying these sprays could adversely affect our bees. Now, mostly bees are inside at night and the spraying's done at night, but there's still the opportunity for those chemicals to be there. And it created a ripple effect, and that's something it didn't even affect that many people, but for the people it affected, it was a really big deal. They had to tent their hives and protect their asset as best they could.
Sure. Now, as far as an outbreak of anything, even if it's in our ponds in the summer, that you test the water, and often you'll have to close down the ponds. You use the same basic principles.
It is exactly the same thing. Even the ponds, even if we have a positive bacteria hit, we close the ponds, but we can retest out of it, which means we take a test the following day and it comes back clean. Okay, so statistically, 1 out of 2 wasn't enough. It's when we see the counts high enough and we see the counts consistent enough that we say, ooh, now there really is a threat there and we need to take some different action.
Right.
Yeah.
I think one of the most important things that a town can do is just prove to its citizens that it's thoughtful.
Yeah.
The town plan for all hazards is thoughtful.
It is.
So if you were to give advice to parents, to just any of the other people in town out there who are watching the national news, and rightly so, are monitoring the situation, as you'd be silly not to.
As they should be, yeah.
What is your overall advice to people in general? So
it's interesting that you bring that up, because there is, I agree with you, there is some sort of thought out there. And I understand everyone's entitled to their own opinions, but that somehow there's some magical information or magical knowledge that's not being shared. And I assure you, at least in Pembroke, at least the information I'm given, that nothing can be further from the truth. That is also true. I work with the emergency management directors, in both police and fire, and that is also true with them. I have worked with them very closely on very serious issues. And you brought up the schools. I also work very closely with the superintendent of schools, and I can assure you she is as erstwhile, and we share all the information we can. There is one exception, of course, where HIPAA laws come into place and child protection laws. Obviously, we can't share personal information about a minor. We cannot share people's personal medical information. But when it comes to the overall threats, we are messaging. And a lot of people are like, well, someone's sitting in a closed room making decisions. It's actually a team of us. And believe it or not, we are having a lot of dialogue about where we're at with the situation, what is the best course of action. We craft a message, and that message is out as soon as we can come to a consensus on, we are at this kind of a level, we need this kind of a response, and we have a plan. And as soon as that information is out there, we're out there. But you also brought up another great point of people looking for information, and this is overlooked so much in my opinion, but the CDC and the DPH, Mass Department of Public Health, and the Center for Disease Control have fantastic websites out there. Anyone can Google them at any time. You want to know the absolute latest on the coronavirus, get on there. And the funny thing is, everyone says, well, they're not sharing all the information either. So I was on a conference call just yesterday with Commissioner Burrell, who is our public health commissioner, and she was straight up answering all the questions she could with all the latest information. And she once again reminded them, as soon as the information hits her desk, they are crafting a message, and it is on the Mass Department of Public Health website as fast as someone can write the message and type it. So, those are great resources. The information really is.
Now, just so people understand where does the actual mandate come from? Is it federal to state to local?
It's going to depend. And I know, again, that sounds horrible. In this situation of coronavirus, yes, it's going to come from the federal government. And the reason it is because this is a global pandemic. Now, if it were something like Tripoli or West Nile, obviously mosquitoes aren't flying hundreds of miles. They're certainly not flying to China. So that's going to be more local. So most of the West Nile and the Tripoli and those things will originate from a state level. Now let's pretend we had just some really bad virus breaking out at a particular school. And obviously they're not going to, state's not going to get involved. They're not going to go to Duxbury and close the school. That's going to be handled within our community right at the source. So it's really going to depend on the source and the ability to spread.
And it all comes back to data.
It does.
It really does.
And again, I'd like to remind people that the person that is ill feels horrible, and I feel horrible for them. But it really has to do, it's really a mathematical, statistical game of transmission and number of persons affected that will lead to what level of response. But if someone is sick, people say, well, I don't trust this, or I don't feel good about this situation. People have the right to keep their child home. People have the right to make other decisions.
Yep.
And by all means, if someone is ill and has concerns, and I actually talked to one citizen yesterday that was concerned about her symptoms and didn't feel like the medical information she got was the best, I said, so seek a second opinion.
Sure. Right.
Start with your primary. You should always start with your primary for 100 reasons, hopefully because they know you.
Yep.
But if you're not satisfied with the response you get, do go to a hospital walk-in, do go to a walk-in clinic somewhere else, and have yourself checked out. There's no harm in that.
Right. Okay. So if people want to know just information for the town, it's always on the town website.
Always on the town website.
Anything
as fast
you need
as we
to
can
get
get
out
up there. And sometimes it's as simple as a link to the states because it's so much better than
Right.
ours.
So
as far as quantifiable data.
And you use Facebook, the town Facebook
Oh, yeah,
page.
we push out the messages that way too.
Immediately,
Especially if there's alerts. If there's alerts that are time sensitive, those are going to hit the town website. They're going to immediately be pushed to Facebook, Twitter, and every other format we have.
Okay.
So,
Lisa Cullity, the health agent for the town of Pembroke.
you.
Thank you so much.
Thank you for having me.
Thank you. And this has been Town Talk.